Hi, everyone, and welcome to World Doc Allen Podcast. I'm excited to welcome to the program World Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic, heart palpitations in pregnancy. What are the effects of pregnancy on the heart?
Well, the main effect of pregnancy on the heart is increasing cardiac output. Now, cardiac output is the amount of blood that the heart pumps in a minute. And of course, it's necessary because you've got a whole much bigger uterus, and you have to supply a placenta and a baby. So cardiac output is the main change, and the way that the heart gets the cardiac output increased mostly is by increasing its rate.
What are the symptoms and causes of heart palpitations during pregnancy?
Well, palpitations would most often be felt in the chest, like a skipped beat. But there's also a fast heart rate, which is too fast, like say 150 or 200, and that you'd feel more likely in your neck or in your head.
Is shortness of breath a problem in pregnancy?
Well, in a way it is a problem because shortness of breath is normal for pregnancy, at least the feeling of being short of breath, because of the way that breathing has to be changed in order to accommodate pregnancy. So if you really have some other problems, say for example, if you have a really slow heart rate, like 40 or so, and you stand up and you faint, that's going to be the only way you really feel or know that you have a slow heartbeat.
Can heart palpitations during pregnancy harm a growing fetus?
Well, it all depends on how fast the heart rate goes, what kind of rhythm you have, what the EKG looks like, and how often you're affected. So for the most part, I don't think that heartbeat irregularities cause a problem, but it's something you should get checked out if you think you're having them.
When should I call a doctor about heart palpitations or shortness of breath?
Well, like I said, shortness of breath is part of being pregnant, but it is also part of being sick. For example, some women, when they get pregnant, will have a pulmonary embolus, and that is associated with real shortness of breath. So anytime you're short of breath, you can call your doctor, go to the emergency room, or go to labor and delivery, but you should get it checked out. Probably there's nothing abnormal, nothing wrong, but you don't know until you go in and get checked.
And the best place to go is worlddocallen.com and safepregnancy.com. Appreciate it, Doc.
Thanks, Neil.
All right, that was the World Doc Allen Podcast, guys.